I'm a therapist for men, and these are some of the rules that I break regularly as a therapist. I will curse first. A lot of therapists wait for their clients to swear before they will. I swear as a part of my regular vocabulary, and so if you don't like that, I'm probably not a good therapist for you. I also want to make sure that you know that you can speak freely and openly and unfiltered in the room with me. I don't speak with an overly regulated or soft tone of voice to make sure that you feel emotionally tended to. Fuck that. No, I'm gonna speak like I speak because I know that you guys can smell that bullshit from a mile away. And if I'm not showing up as myself, then why the hell would you? On that same note, I ask my clients the question, why? This may seem crazy, but a lot of therapists have been taught in graduate school never to ask the question, why? It's suggested that maybe it seems judgmental, or we need to couch it, we need to deliver our curiosity in a different package. But the reality is, I ask why as a human being, and I actually think it's a pretty legitimate question to ask a lot of the times. Now, I don't ask it like an asshole. I ask it out of curiosity. I also use a lot of self-disclosure in my session. I think it's really important that you know I'm a flawed individual just like you. So I'll talk about my experiences in therapy as a client. I'll even talk to clients about the fact that I take medication to help me manage my anxiety. I will share about some of my struggles. I will relate to childhood experiences that maybe resonate for my client. I will bring things into the room that help my clients know me, because I believe that is critically important for my male clients to be able to trust me and bring themselves honestly into therapy. Relatedly, I will answer questions about myself that my clients ask. I will never, ever respond to a client who's asked me a question by first saying, "Can you tell me where that question may be coming from?" Who talks like that? Who talks like that? Here's the thing, when we treat our clients like humans, they treat us like humans. So 99% of the time, if a client has a question they'd like to ask of me, they preface it with, "Now, I know I'm not really supposed to ask you questions about yourself, and I totally get it if you might not answer this." Clients get that. We still may explore like why that question and knowing these things about me might feel valuable for them. But again, I'm going to break this rule of immediately putting a wall up when a client asks me a question. I don't offer my clients any seat in the room. I have a couch. It's very comfortable and it's just for them. I have my chair. It's just for me. This is something some therapists will do. They'll walk a client into their office for the first time and say, "Have a seat wherever you'd like. Have a seat wherever you're most comfortable." I actually think that's awkward. I actually think that would make me feel